Hello, everybody. Thanks for coming. It's an intimate group tonight. However, the problem is as big as ever, so I think it's important that we have this, and thanks for coming. I'm actually not going to open. There's some other people that are going to be speaking, but I wanted to start. There had been some recent overdose deaths, I think, in the past week. Ray, you had mentioned me in this area, so it continues to be a problem, as a lot of you know. So thanks for coming. Both of the groups, the AAPS and the Drug Crisis Group, are about driving awareness, and so we continue to do that. I'm going to start. Some of you may not be aware of a campaign that's going on now. The governor has a campaign called Combat Heroin. I'm going to play an intro from the governor that'll give you an idea of what the program is about, and then Susan will open up. Thanks.
They say in substance abuse, the first step is to admit the problem and not deny the problem. Well, with that theory, the state of New York has a problem with heroin. And it is not, heroin is a problem nationwide. Our problem is much, much worse. 1/3 of all the heroin confiscated last year in this country came from the state of New York. 1/3. We've had double the number of deaths in just 4 years in the state of New York. And people say, well, we had heroin before. This heroin is much worse than the heroin of the 60s or the 70s. It is much more powerful. It is much more concentrated. It is much more addictive. It's much cheaper. They're selling $5 bags and $10 bags of heroin. And once a young person starts, it's incredibly difficult to get them to stop. And this heroin is for younger users than the older heroin was. Older heroin in the 60s and the 70s were about people who were 28, 30, 32. These are teenagers. These are high school kids. And it's getting younger and younger. And it's not a problem that is over there. This is a problem that is primarily upstate New York, primarily suburban, rural communities, primarily middle class and affluent communities, primarily white, and it is growing exponentially. So, working together, as you heard, we've come up with a truly comprehensive approach, where we start with law enforcement, as a public safety issue, 100 new troopers dedicated just to this, trained in heroin interdiction, heroin treatment. That's job one, and we give them another round of applause, and we thank them for their service. We are increasing the criminal penalties for distributors, dealers, pharmacists, anyone who would be engaged in the dissemination of the product. We are starting a training campaign on schools all across the state, SUNY schools, also private schools, where the police, the teachers, etc., will be trained in observing heroin, etc. We have a public awareness campaign. We have changed the law so that insurance companies must provide treatment, and the insurance companies, which historically love to play games with treatment and find delays, we have a regulatory agency that's going to make sure the insurance companies are providing treatment when the people actually need treatment. So we're doing everything that government can do, from the laws to the crimes. We're doing everything that government can do. But this is not a problem that government alone is going to solve. And I don't want anyone to leave here today and say, well, that's taken care of. They passed the law, the troopers, the police, the teachers. This is worse than that. And it's not a problem that government and teachers and other people are going to solve. It's a problem that is only going to be solved when each and every one of us takes our own responsibility. When it comes to security, they use an expression, if you see something, say something, right? Every one of us is in charge with citizens' responsibility for safety. So if you see something, say something. Well, with that same sense of individual responsibility and acknowledging community responsibility and community connections, we want to say, if you know something, do something. I can't tell you how many people have come up to me and said, you know, I knew something was wrong. Or my son is his son's friend, and I knew he was on drugs. Or my daughter told me she was at a party and she saw him taking heroin. But I didn't say anything, I didn't do anything, and now it's too late. Because people think someone else is going to do it. It's someone else's responsibility. It's not their place. It's all of our place, right? Because Deanna's son is my son, is your son, because we are all connected. And we do care all about one another. It's not enough to do for yourself and do for your family. We're here to do for ourselves. And when everyone acknowledges their responsibility, that's when we will really get ahead of this crisis and this epidemic. So we're going to be doing what we need to do. And we're going to do it with bipartisan resolve, and we're going to do it with competence, and we're not going to spare any resources. But it's a fight that we have to fight together. So I'm here today to ask for your help in this also. It's your neighbor, it's your relative, it's your child's friend who may be the next victim if we don't act.
It was our son. My name is Susan Salamone. We lost our son on May 29th, 2012. And Governor Cuomo's address is compassionate and heartfelt. And when I first saw that, I was impressed with his acknowledgement of this disease. We started Drug Crisis in Our Backyard after the death of our son because no one knew what was going on back then. As far as we could tell, we couldn't get any information on it. And we met Jamie and Shelley, who started Dutchess AAPS about a year ago. We helped them begin their grassroots organization so they could spread this out throughout Dutchess County. So now I say, as the governor said, it's up to us. I mean, we don't have a big auditorium filled with people here, but we are here. And it's up to us to spread the word on this terrible epidemic that has struck our area. The Hudson Valley is one of the worst hit. Ray said there was 2 overdose deaths this week. Like, where are the people? They should be here tonight so that we could move forward. Doreen Lockwood, she works for Putnam Family and Community Services. She says she doesn't matter, and it doesn't matter how many people come to these forums, because if we reach one person, that's one more person we reached. And one of you will talk to 4 more people. So if there's 20 of us here, there's really 80 people that will be reached. So from this evening, because we brought a lot of nice speakers in here tonight, we hope that you will get some information that you could bring forward to the next 4 people, and they'll bring it to 4 more people, so that we could continue to spread the word about this terrible epidemic and save lives, because I wish that my son's life could have been saved. And with that, I'd like to introduce our first speaker, Dr. Kari Reba. She's the Commissioner of Health for Dutchess County, and she is so great. She's helped us do Narcan training, and she's always willing to come forward. So thank you for coming. We really appreciate it.
Thank you, Susan. Can everybody hear me? I'll try to speak loud. I was interested in the substance abuse concern from the medical examiner's perspective, most unfortunately, and that's not a happy place to be. But I was a medical examiner in the city of New York for 10 years, and then I came up here to Poughkeepsie to start the office in 2003. And I saw, you know, quite a bit of disturbing things when I was in New York City. But I don't recall ever, you know, seeing so many drug overdoses. So when I came up here, it was 2003, and I think it was just starting. I mean, there were some cases of oxycodone and so forth, but it was just starting. But even then, I never expected to see the number of fatalities, you know, from drugs that I was seeing. So I started to watch this very carefully. I accumulated, you know, data year after year, and over the last 10 years since I've been here, essentially the number of overdose deaths has tripled, and this mirrors what's happening in the rest of the country. The interesting thing also is that back in 2000 and 2003, the percent, this is nationwide as well, the percentage of opiates within those drug overdose used to be about 20 to 30%. And then by 2012, it was like 60% of the drugs. And this year, it's more than 99%. So, so far this year, and I only have numbers, I know there have been a couple of overdoses, supposedly, in the past couple of weeks, but until I confirm the toxicology, I won't, you know, say that there are, because you never know. And so far through August, we've had 34 overdose deaths, and only 2 of those did not have opiates on board. And this is, to me, a change. And we're also seeing an increase in heroin use, and it doubled between 2010 and 2012. The increase that we are seeing in heroin really started in 2009. So in my opinion, it's being driven by the prescription painkiller addiction epidemic, and not by the I-Stop law, or not by, you know, other attempts to reduce the amount of drugs available. People who get hooked on the painkillers will turn to heroin because it's cheaper, it's readily available, and when there's a demand on, you know, unfortunately, there's always a willing supply. This is a big business, and lots of money is involved. But you know, the overdose deaths that we see in the medical examiner's office, that's just one part of the picture. You know, we have to consider the suicidal deaths. We're seeing increasing numbers of people committing suicide with prescription drugs. Generally, it's one drug and not more than one drug. The accidental overdoses tend to be 3 to 4 to 5 subscription drugs plus heroin or cocaine. Lots of mixtures. And the danger with this is that, you know, people who, for example, somebody who has a mental health issue will be on a benzodiazepine for many years, and then they break a bone and they're put on oxycodone, and then the effect is cumulative because they're both respiratory depressants. So you don't have to be an addict, unfortunately, to pass away. And in fact, I know a story of a man in his 40s who had never taken a pill in his life. He had never been sick, and he sustained an injury that required surgery, and he was in a lot of pain, and he was given both oxycodone and Valium, and 3 days later he died of an overdose because he just didn't understand, you know, how dangerous these drugs were. And I don't think that that's explained properly to patients either. And then each person is different, so you know, people's level of tolerance is very different. The other thing that, you know, we need to look at, and that doesn't even count in my estimates, are motor vehicle accidents. I mean, how many fatal car accidents are due to the driver of the car involved being on drugs and alcohol? And what about the driver of the other car that caused the accident? We can't even capture that information because we don't always know it. And so it's affecting so many different levels of people's lives. And those numbers, you know, can't be captured. Elderly people, until recently, I'd say until the last couple of years, The great majority of people who died of overdose due to prescription drugs were between 45 and 65 years old. Unfortunately, the amount of drugs available then in the medicine cabinet and so forth, the kids started to take it, so we're seeing a decrease in the age range now. We're seeing sort of across the board. It's no longer that peak at the older ages. But, you know, elderly people who are taking a lot of drugs have a higher tendency to fall and to sustain hip fractures and to end up in hospital with complications and, you know, pneumonia and so forth. So here also, how does the drugs factor in? And when you see some, you know, what is in the medicine cabinet of a lot of elderly people, including my mother, I'm absolutely shocked at the drugs that are given. So there also, there's a problem. And then finally, let's not forget the violent deaths. Most of our homicide victims have drugs in their system when they're killed by another person. And what about the person who killed them? It's more likely that even higher, you know, that they have a substance on board. It's not always opiates, but it can be a mixture of the two. So I just wanted to close my comments, and then I can answer questions afterwards if anyone has any. But you know, Dutchess County is really committed to work on this, just like the governor said. We're doing the same thing. We're working with our drug task force. We're trying to find a way to capture data better so that we can find out how many survivors there are, because that gives a better picture of the severity of the problem and better way to estimate how our interventions are working. You know, we're also working very hard on prevention, and that's very important. Unfortunately, people who are already addicted are not going to benefit from that. So we are going to be trying to increase the amount of medication-assisted treatment programs to see if we can help in that respect. And there's one thing that you can bring back to your community and to your friends and so forth. When we have tried on multiple occasions to open more rehabilitation clinics and so forth in communities, the communities have not wanted them. So there's a strong negative push against methadone clinics, and there are many different ways of recovering and many different, you know, treatment options. They do not want those treatment centers in their backyard. And so if you can do anything, you know, I think that that's where you can start to make a difference. Thank you.
Thank you, Dr. Reamer. Our next speaker brings to us over 30 years of experience in the field of behavioral health and addiction. Dr. Raymond Doherty, PhD of Phoenix House Academy, is the community outreach clinician for the Hudson Valley and primarily works with adolescents and young adults. Okay, please welcome Dr. Raymond Doherty. And you're welcome to come up, if you feel better standing, you're welcome to come up here as well.
I guess I can sit and talk and make it informal for the most part. Can everybody hear me? Yes. Okay. My name is Ray Doherty, and I'm with Phoenix House. And Phoenix House is one of the largest nonprofit drug and alcohol treatment programs in the country. We have programs in 12 states and the District of Columbia. As some of you may know, Phoenix House was founded in 1974 by three individuals attempting to recover from heroin abuse. So we have been recognized nationally as one of the premier providers for opioid heroin addiction since our inception. And what began to happen is primarily many of our patients for our New York programs were coming from primarily the 4 boroughs of New York City and downstate. And what began to happen about 4 to 5 years ago is that we began to see an increasing number of admissions for heroin, for opiate abuse, of middle-class, suburban young people, which really began to create some concerns amongst the treatment professionals at Phoenix House as to, you know, why this is happening. So our doctor, Dr. Andrew Kolodny, who's one of the experts recognized in heroin and opiate addiction, began to develop some specific programs designed for young adults and adolescents. We just recently opened up an adolescent young adult facility that can treat with both naltrexone and Suboxone in Yorktown, which is right on the border of Putnam and Yorktown off Route 6. But what we see is the need for a continued vigilance in developing programs, not just for heroin, but for some of the other drugs. And I've been doing this for a long time. And nobody comes in and says, I started my passage into addiction by shooting heroin intravenously. Okay, it usually started with alcohol, it usually started with marijuana, because what begins to happen is an adolescent young adult gets desensitized to the consequences of substance use once they begin to use and experiment and don't suffer any type of consequences. So I really embrace the idea of prevention. I really embrace the idea of grassroots organizations, community organizations coming together, because that's what's going to make a difference. As a treatment provider, we can only treat those that have gotten to the point where treatment is absolutely necessary and they're in the throes of addiction. And it takes us months and months to work with an individual that's addicted. As many of you know, for the most part, the medical model used to be short-term detox followed by outpatient treatment. And that's what insurance companies adopted and adapted to, and treatment programs adapted to that model. What we're finding now, particularly with opioid and heroin abuse, is that that model doesn't work. You cannot put somebody into a 5, 6, 7, 10-day detox and then put them into outpatient when all they can think about from the moment they wake up to the moment they go to bed is getting high. It doesn't work with those types of individuals, with those types of patients. So one of the things that I would say and mention is that we really want to look at prevention at an early age. As a parent, talk to your children as early as possible. You know, I rarely hear about an adolescent or a young person drinking bleach, but yet every day I hear about a young person drinking alcohol. You know, as parents, we make sure there are certain things our kids learn from the very beginning not to do. Don't touch a hot stove. You know, don't touch these things. We protect them from so many other things in our house, but when we talk about protecting them from the medicine cabinet, when we talk about protecting them from the bar, if we have alcohol in our homes, we need to be hyper vigilant. You need to be involved in your children's lives, because I wind up getting involved in it at some point, and it's a much longer process to work on rehabilitation. So part of what I would say is there is hope. People get well, people do recover, but the more that we can do as a community to really stress the importance of prevention, of not picking up that drink, not smoking that weed, not being around, don't tolerance. One of the things is that I grew up in the Bronx many years ago, all right? Most of us were intolerant to a lot of different types of things. But one of the things that I see is our young people today are tolerant of almost everything, including other kids who drink or get high. I have a son who just graduated high school. He knew kids that would drink or get high, and I would say, you know, but why don't you say something? And he's like, well, what do you say? What do you do? So for most of us, what we need to do is get that message out that it's not okay. Encourage young people to confront other young people. Encourage parents to confront their kids. Do more with CAPE here in Dutchess County, with AAPS, with Drug Crisis in Our Backyard. Get involved from a grassroots perspective, because that's what got Governor Cuomo to do what he did. It was the work and the efforts of people in our communities that said enough is enough, and we really need to do something. So I think even though there's a small group here, we have a loud voice. And I think if we continue to talk about what's happening and what needs to happen, officials will respond. And we talk about cultural change, changing the culture, that it's not okay, it's not acceptable to drink and get drunk or to smoke weed. And I think that if we can begin that process as we are tonight from a grassroots perspective, it will in turn help those that take that fall wind up with an addiction, because the earlier I intervene on someone, the more likely they are to have a successful treatment episode and go on to long-term recovery. But it's very, very difficult to treat somebody in their mid-20s that has experienced years of addiction and has reached bottom to come back up and try to get back on top. And it doesn't take 3 days, 5 days, 2 weeks, even 2 months. It's a lifelong process. So whatever we can do to intervene as early as we can, we need to do.
Thanks,
Thank you, Dr. Doherty. High Watch Recovery Center is located in Kent, Connecticut, is a residential medical facility. Experts in treating alcoholism and drug addiction, High Watch takes pride in providing state-of-the-art treatment for substance use disorders and coexistent psychiatric disorders. Our next speaker has personal experience in the field and is the admissions director of High Watch Recovery Center. Please welcome Mr. Robert Schwartz.
Hi, I'm Rob Schwartz, and thank you for inviting me tonight. I'm here to represent High Watch Recovery Center, and we're in Kent, Connecticut. We're considered a small facility. We have 78 licensed beds. 7 are for a long-term charity care program we have, and the other beds are available for patients from 18 and up. We get a wide range of alcohol to heroin. It started in 1940, the facility, and it was Bill Wilson, the co-founder of Alcoholics Anonymous, was instrumental in finding High Watch. He came up there early on. It had been a spiritual retreat, and he was instrumental in coming up, presenting the idea of the 12 steps to Sister Frances, who owned the facility at the time. Her husband had passed away, and she was enamored with the idea of helping alcoholics, and it then later became she decided to donate the land to the cause of AA. AA couldn't take donations, so it became a non-profit organization for trying to help alcoholics. Through the years, it's evolved, and in 2005, our director, Janina Keene, brought in a psychiatrist and a clinical team. So we now, treat co-occurring disorders. We offer a family program as well, and we're heavily entrenched still in the 12 steps. So we have a wide range of clientele. I myself came there in 2005 as a patient, alcohol and cocaine addict. I stayed there for a while. I had to be there for 90 days. I ended up staying for a year in this extended charity program they had, where I became a dorm monitor and stayed on. I later was hired there about a year and a half later. So I've been there about 7 years as an employee now. I think an experience I had today may be helpful for some of you. And that was, we had a young man that was addicted to heroin. And he was, I spoke with him on the phone. We did a phone interview with him. We sent him out for detox several days ago. His parents and their young, his sister came in, and we did a tour with him of the facility. They had already committed to bring him to High Watch after the detox. What happened was, he was in the detox several days. The insurance company no longer deemed it medically necessary and said, he wasn't symptomatic. So he then left the detox, called his parents, who in the meantime were in a panic, and called me. And they said, Rob, what do I do? Our son left the detox, we don't know what to do. I said, well, unfortunately I deal with a lot of parents and significant others before we, get the patients in. And I said, well, you have two choices. When he does call you, tell him, you need to go back to detox, and then you need to come to High Watch. You're no longer welcome home. That's where he lives. He's 20 years old. Or if you feel the need, you call the police and report him missing, because, God forbid he overdoses or something in the meantime and they don't do anything, So that was the best advice I felt I could give him. The result was the father he then called the father from a Starbucks. The father went down, picked him up, brought him up to our facility, and he told the father that, he was willing to come in. So I interviewed him. He said, yeah, I'm more than willing to come in. I had to get approval from our psychiatrist, and we explained what happened, and he said, is he motivated for treatment? I said, sure, because I talked to him. He said he was very motivated. I then came back, and I said, we have good news. We're going to be able to admit you. And he says, I'd like to talk to you, Rob. So I brought him in my office. His father was there. And he says, I don't want to come till Monday. He says, I was really hoping you wouldn't be able to take me because, you know, the detox indicated that you may not be able to take me, and I was hoping you wouldn't be able to take me. I said, well, we can take you, you know, and I said, you may be a little uncomfortable, but whether it's now or Monday, you're going to still have some withdrawal symptoms. I mean, he was using 20 to 30 bags of heroin, snorting. So he says, well, he says, do you have to tell my father? I said, yeah, your father has to know that we can take you today. He goes, well, let me go talk to him. So he takes the father outside and talks, and then the father comes and he says, Rob, you know, he says, I'm so sorry you can't take my son. I said, well, no, we didn't say we can't take your son. I said, as a matter of fact, I tried to explain to your son that he should stay here, tough it out. This is his best, you know, best chance of recovery, and nothing good could happen to him going home. So he proceeded to go out and talk to his son. They ended up in a big argument, and the son was, you know, adamant about not coming in, and the father said, you either go in, or I'm going to call the police and bring you right to the police station. So, you know, this went on for about a half hour outside the office, and finally the son says, fine, I'll go. And he came in, you know, and then, so we ended up, you know, having to search him, doing the admission, and the father then came in my office. He says, you know, that was the hardest thing ever to do, but I couldn't have him destroy the family and come home, and, you know, we've had enough. And I said, well, you did the right thing, because if you did anything else, I said, he would have played you out, you know, because he'd been getting away with this for years, and if you didn't put your foot down, nothing would happen. He'd be home, he'd put it off, you know, and the truth of the matter is, this is what happens. And our director, Janina Keene, she's an expert in addiction. She's a Yale graduate. She's fantastic. She runs our family program, and it's every third weekend. Every patient has to attend, and they can invite 2 family members. It's all inclusive in the program. And she always asks the question, you know, had you not, you know, how many people here would have come to treatment sooner had they been forced? And almost every guest raises their hand, you know. So I guess the moral of the story is for people that are struggling with what to do with their loved one is confront them and give them an ultimatum. You know, that's what we've seen to work, you know. But we're available for treatment. They can stay as long as they want. The minimum stay is 21 nights. We do not accept insurance. We are private pay, but we are nonprofit. We do pride ourselves on keeping treatment affordable. It's slightly over $8,000 for the 21 nights, and then it's $357 a day thereafter, basically $2,500 a week. We have full support. We have a whole clinical staff. Everyone's assigned a therapist. They meet with 3 times a week. We have to have an aftercare coordinator, so we provide them any services they need going forward, sober housing, therapy, psychiatry, and we have a psychiatrist on staff who also serves on our board. So, thank you for listening.
Thank you. Thank you, Rob.
The Walter Hoving Home is in Garrison, New York. It's a residential, spiritually based home, a nonprofit organization serving women ages 18 and over who have been involved in drug addiction, alcoholism, prostitution, and other life-controlling problems. The 6 or 12-month program is known for rebuilding broken lives in an atmosphere of warmth, trust, support, and love. Our next speaker, originally from Orlando, Florida, comes to us with her own personal experience and is the outreach director for the Walter Hoving Home. Please welcome Emily Nelson.
Hi, y'all. Sorry, I'm going to stand because it's just a lot easier for me. I am a product of the opiate epidemic within our country. My statistics are a little different because I'm doing well today, but I can come from a completely different experience as far as where it has developed, where it has changed. And coming from Florida, which is one of the most, where they have one of the most known pill mills, is what they call them, doctor's offices that produce out prescriptions that are just to exceed amounts that nobody should even be taking, even as a cancer patient, that they probably shouldn't really be taking. I personally used to be able to get 360 30 milligram Roxycontins prescribed to me, and that was at one doctor. And I played the doctor game. I went to multiple different doctors, and I've been kind of around the evolving of how things have kind of changed. I'm getting onto a database and things of that nature. But I actually started smoking marijuana. That's where I started. I was 8 years old. So it was almost like I kind of was really, at a start where nothing was really going for me starting at that young, as far as that goes. Drugs were not talked about within my household. I know that my world would have been completely different if somebody was talking about drugs in my household, telling me that they're bad, beyond the DARE programs, because when I got to DARE, I was in the 5th grade, and I have already been introduced to marijuana in the 3rd grade. So it was like, if we could have been talking about that even at 5th grade, if a DARE was introduced to me, then I could have been told a little bit more about how bad that drugs are for me. I, in turn, ended up selling weed by the time I was 14 years old. I started using heavily by the time I was 16. My first drug that I was addicted to was ecstasy, and it just kind of evolved from there. I became an IV drug user at the age of 19, and I really primarily ended up liking opiates. That's kind of where I ended up sticking at. I've been addicted to just about everything, but opiates is what got a hold of me. I have a lot of bad stories. I shot up a girl with a 40 milligram Oxycontin, and she turned blue. So she overdosed and had stopped breathing. And my boyfriend at the time threw her over his shoulder, and we were at a 3rd-story apartment building. And by the time we got down, because of the pressure of the chest hitting here, she at least started grasping for air. And I drove her to the hospital, and I didn't care about the police that were showing up. I didn't care about the questions that I knew I was going to get, because even though I was high, even though I was in this world, there was still this little bit of good in me that wanted to come out, and I at least knew that I needed to do that, even though I was guilty of what had happened to her. And at that point, obviously, I lied to the police. I came up to the home in Garrison, New York in February of 2011, so I went through the program. It is a year-long program. It's different than anything else. It's a Christian program, so we believe in having a personal relationship with Jesus Christ will save and change you, and it has for my life. It's not a requirement for someone to be Christian to come into the program. I was not. I was far from anything of that, and didn't even believe really in God, or thought that anybody really ever cared about me. I had tried NA programs, I have tried methadone programs, I have tried Suboxone, I have done therapy, drug counseling therapy. I have done a wilderness program that wound me up in Colorado. It was a $30,000 wilderness program. I camped in the woods for 14 weeks. At the time, Oprah recommended it as being the #1 program in the nation, so that's where I ended up, as my dad went ahead and put his retirement on there for me to be able to get there. And 5 days after I came out, I relapsed on heroin. It was just kind of that severe. And the thing is that I didn't know what I really needed was a lifestyle change. And at the Walter Hoving Home, we provide ladies the opportunity to be able to do that, because it's so much deeper than just the drugs. It's why did I ever turn to drugs and alcohol in the first place? What is it that I didn't learn growing up? What are the coping mechanisms that maybe I missed out on? Stress. I never knew how to handle or deal with stress. Healthy relationships. I didn't even know that term. I didn't even know that existed. Codependency, just those things that I all had wrapped up inside of me that I really had to be able to get to and get to the focus of. And I was able to do that at the Walter Hoving Home. We are a facility that's only 30 minutes from here. We only house women. We house right now 75 women at max capacity. And as far as finances go, we are a nonprofit organization. And what we ask for, if someone receives SSI or SSD, we would ask for 90% of that. If they don't receive that, we request a donation of $500 a month. But if they can't come up with that, we will take them in. I paid, I think my dad contributed a couple $100 during the course of the year that I was there, but I essentially really didn't pay anything during the time that I was there. It is run on donations alone, and to me that's just a miracle in itself, that other people were investing in me and continue to invest in other people's lives for them to be able to have a life change as well, so that that way they can be able to have productive lives. I have now been working there. In February it'll be 2 years. It's just an absolute miracle to me that I'm able to do that today. It's just absolutely transformed my world. And you know, I want to say that the pill epidemic or the opiate epidemic is getting better, but it's not. I just went home to Florida just last week, and I had a friend of mine who didn't really know what my addiction were pills, and he started telling me how he couldn't get his Loratabs filled, and he really did have a really swollen knee, like he probably does need them, but I'm scared of them. I was scared for him that he was even taking that, because that links them to heavier drugs without him really realizing it. And he told me he couldn't even get his prescription filled. And I knew way too well why he couldn't get his prescription filled, because there's too many doctors writing prescriptions that they shouldn't be, that the pharmacies actually run out of the medication for them to be able to be filled. So I know that it can get better, though. You know, just what the campaign that the senator's got going on is great. I encourage each one of you to be able to talk to someone openly about the epidemic, that it would just be an open dialogue to whoever will listen, really, because I'm willing to talk to anybody about it. My life used to be consumed by using, and now it's more consumed about how to be productive and be able to help people not turn back to that lifestyle. You know, there's a very much so a big pull. It stinks that I can't, you know, trap people at the home because they can leave. You know, they have the opportunity to leave, and that's the hardest thing about addiction, is that when somebody's not ready, it's just rough. You know, rock bottom for them might happen a couple times. It happened multiple times for me. I ended up in jail, tried to commit suicide while I was in jail. That wasn't rock bottom enough for me. Ended up homeless in South Florida. That was not rock bottom enough for me. I had many different rock bottoms before I ever got to the opportunity where I was like, all right, I just have to do something different. But I would be grateful to answer any questions that you have, talk to you more about the Walter Hoving home in more detail, because every case is individually different. Everybody's story is different, everybody's child is different, everybody's family member is different, but it's just crazy how this has really just attacked all walks of life. You know, it really has. I really don't think I can run into someone anymore that doesn't know somebody that, you know, has an addiction issue or has it within the family. And, you know, it's like people don't want to talk about the pink elephant in the room. Well, the pink elephant's in the room, and people need to be talking about it, because I know my life would have been different if it would have been talked about, or even if my family was like, hey, I know you're on drugs. You know, they didn't really do that. I wish they would have. I was always the last one to know that everybody knew I was on drugs. But, yeah, that's all I have to say.
So before we gear toward our question and answer session, we just want to thank our guest speakers for taking the time to come here. We really appreciate your time. We also want to thank you for making the trip and taking, you know, time out of your busy lives to join us to help educate ourselves and keep talking about it. So thank you very much. Stephen Salamone, co-founder of Drug Crisis in Our Backyard, Susan's husband, is going to now come around with the microphone if anyone has any questions for our panel.
Just come around with the microphone. I won't say anything. That's all I'll do. I actually want to thank you for coming. You know, the analogy I'm going to use, you know, the English said in the Revolutionary War that the English said during the Revolutionary War that they were blown away because the largest army in the world, most structured army in the world, was defeated by farmers with pickaxes and shovels. Okay, and I kind of feel like that's what we got to think about right now. We're at war, and we're the farmers, and it may not look like we're a big group or that we're that organized, but you know, damn it, we can do it. But you got to talk about it, you got to talk to your neighbors about it, and you got to feel almost militant about trying to get the word out. Given what's going on around here, these seats should be filled. We should be at capacity, and we're not. It's a disgrace. I appreciate you being here. Get more people to come to these kinds of things, because we're not going to defeat it. The government's not going to defeat it. We're going to defeat it. But pick up your pickaxes and shovels. So, anybody have any questions?
Just ask a question. You know, anybody could answer this, but a few years ago, probably more years ago than it seems like, there was a form of censorship of TV advertising for cigarettes, huh? Now, that word censorship is a bad word in this country. Do you think that it would be possible, ever, to have some of the media that glorifies this lifestyle, such as movies and music, anything that glorifies this lifestyle, because the message of you shouldn't do this, which we're trying to put out there, is strongly contested by the message of this lifestyle is cool, that especially the young people get. So just a thought. I mean, we're not going to do it from this room, but I mean, I think that if we could censor the TV advertising for cigarettes, then maybe some form of censorship could take place for anything that glorifies this lifestyle.
Comments, anybody?
There is within, kind of like in the music industry, something that's called straight edge, which would mean they actually go ahead and promote the fact that somebody doesn't drink, doesn't smoke, or doesn't do drugs. So, I mean, that's kind of like the combat of it, and even that, like, some people get mocked for that, and that's like within the culture of like high school, that somebody would be straight edge. So there is kind of that, but I mean, I guess more of it's how would you go about that? Because then someone's going to say, well, this is part of someone's story, like if you look at American Gangster, the story is about heroin. How would you change that? Would you just say that movie wasn't allowed, and then that would go against the censorship of America? Yeah, it's just, how do you combat the culture?
My son used to listen to so much drug music. It was incredible. I remember going, when he was first trying to get clean, going down to New York Presbyterian Hospital down in Columbia Presbyterian in the city, and he had this music on that was all drug music. By the time he had several periods of being clean, he stopped listening to that music. So there certainly is something to say about listening to what your kids are listening to, because it will definitely help you to know if they're going down that path.
And if I could just add, I think part of it also is grassroots organizations. Once again, writing letters. We just at Phoenix House recently did a blog on, Kathy Lee and Hoda. The idea of, Booze Day and Wines Day, and, when the majority of female problem drinkers drink during the day when no one's home and the kids are at school. Here we have, two icons in the TV industry promoting drinking alcohol at 10 o'clock in the morning on a daily basis and laughing about it. And so, we did this blog, talking about that, and immediately, over 1,700 people, responded to it right away off the internet. So I think part of what will happen before censorship is, I think, if we as individuals and grassroots organizations, write a letter to the network, post something online. That's what's going to get the attention of a lot of the people that make those decisions as to what to air and what not to air.
We had a high schooler that spoke about her frustration in Somers, that the school wasn't really being that active and there was this culture. And we said to her, why don't you start? Because she said there's a lot of kids that feel that way. And I said, well, are you organized? And she said, no. So, I think maybe encouraging kids to get self-organized. there are good kids out there. So if they could get a voice maybe amongst themselves and not look out for some kind of formal thing, but just to, let's get, like I said before, it's grassroots. Kids can get together. I think maybe encouraging your kids to get a group together that's kind of, sponsoring clean living would be helpful. It may not work, but it's a thought. I think we need to push that.
If I could just interject, I think Kate on October 30th is doing, a training for SAD representatives from many of the high schools in Dutchess County at ways to intervene and, address and deal with, other young people that are experiencing difficulties or maybe using alcohol or drugs, what to do in those situations. So I think that the more that we can do to promote that and get that information out there makes a difference, because one person does make a difference.
And I just wanted to add that, using the social media, Facebook and so forth, I mean, that's going to be key for kids to communicate with each other, because the advertisements on the bigger media is very expensive, and, we don't have the resource, and plus it has to be repeated all the time, the message. So Facebook could certainly be used for something like that.
Just a couple general things, more of, I guess, comments rather than questions. But the other day, I was watching MTV, and I was actually very impressed because finally there was something on combat heroin. And I was like, wow, I'm seeing something that's actually bringing heroin out, and they're not afraid to use the word heroin. So I think that is just, even though it was one commercial in the probably hour that I watched the TV, it was something. A lot of families, I work at St. Christopher's Inn, I'm a counselor at St. Christopher's Inn, and we help treat men as young as 18. And one of our philosophies is telling them that they are men worthy of love and respect. For some of them, when they come to our facility, it's the first time that they're hearing that, let alone believing that. So when families say, what can I do? It really starts with the messages that we're giving our youth. There's a lot of bullying out there. A lot of people don't think that they're worth it. They don't think that they're loved for. They don't think that they're cared for. So to come to a facility at 18, which is the youngest, and hear that for the first time, it's very difficult to change that mindset and then to internalize that message. So when it comes to interventions, not being afraid to talk about the pill cabinets and things like that is one thing, but also just letting them know that it's okay to feel emotions and be emotional, and it's okay to talk about how they feel and feel loved, doing things as a family. Sometimes society has gotten away from that. They don't know how to have fun. It's okay to go fishing and be sober. That starts with the home. Fathers sometimes bring their kids out to go fishing, and they have a six-pack with them, and it's male bonding. And that's sending the message that fishing and drinking go hand in hand. So when it comes to what can I do, there's a lot that we can do to even just change the messages within the upbringing, building the self-esteem from, an early age, not when they're in their 30s. Sometimes I have a client right now, 60 years old, and he's just starting to love and respect himself because no one else has. So that, I think we have a lot more power than people think, and it starts with just kind words.
Thank you. Questions? Any other questions, comments, anybody?
Documentary filmmaker Greg Williams from the Anonymous People. We had a few conversations. He spoke at our last forum, and one of them was based on, well, it's really in the prevention. And as a public school teacher and as a parent, I really thought about that a lot the last few months. What was my life like growing up? What are my kids' lives like now? And what I really thought of as I see middle school students pass through my gym as a phys ed teacher, and having had 3 of them in the last year, former students, overdose, which is one of the reasons why I do what I do here. I really put even more thought into it. And when I spoke with Greg, we talked a lot about that, and what he had shared with me is that it's not just about having the dialogue, don't do drugs. It's about being involved in your kids' lives at a young age, helping them build self-esteem and confidence, getting them involved in activities. If they're sitting at home every day after school and they're not being active and they're not, developing skills and hobbies, it's going to be hard for them to feel confident. So it's more than just talking about, don't do drugs. It really requires, as a parent, you to be involved, get them involved in things, and help them build their confidence at an early age. I think getting them involved in activities, regardless of their personality or their ability, music, art, something. I know that a lot of students I have in my gym, some of them are athletic, some of them aren't, but we try to, bring out the artist, in our activity that we're doing, or even the musician, because that's their strong point. It makes them feel confident. Not everyone's an athlete. So it's just something to think about and to share with other people who have young people in their lives.
I hear you saying we had the same problem. We didn't know where to go. We didn't know what to do. We didn't know who to call because there was really not any information out there when we were dealing with it. And you're always in crisis when you're dealing with it. You're in crisis at that point. student, so what would make it easier for you? What would make the whole process easier?
For me, I think I'm pretty knowledgeable at this point.
You're one of the most knowledgeable people that
So
I've come across.
it's not for me. I think
Yeah, for someone else that doesn't know, that doesn't know.
people that call that have no idea, they don't even know about Mark.
Can I?
Yeah, please.
The Dutchess County Department of Health, we're finalizing a web page exclusively dedicated to substance abuse, and where we can announce any meeting that's happening. We'll have all the resources available in one place. We're in the process of gathering all that information, and I think that will be very helpful as well.
It probably will. Insurance is a big thing too. If you guys don't take insurance, you're saying you don't even need to have insurance. Phoenix House is usually pretty good about getting.
Why don't you talk about St. Christopher's?
Look, St. Christopher's is fantastic.
Well, right now, we are facing the longest wait list St. Christopher's has ever had. Over 100 men are on the wait list.
Are most of their
And
insurance
we have
covered?
we have 170 plus beds at our facility. We've increased a whole other group to try and help, but we do face insurance issues every day. I can fight my hardest battle to get 5 days for a client because insurance doesn't recognize addiction as a medical necessity. That is a lot of the reason. If it's not a medical necessity, we're cutting you off. So that's a lot of times what we're going up against. A lot of Medicaid is turning over to managed care. So the whole structure of healthcare is completely changing. It's very difficult to get into a detox. People have to use to get into a detox. They have to use to get into a program because if they haven't been using a certain amount of time and their withdrawal symptoms are not to a certain extent, they will be denied. And then you have the other end of the spectrum. We fight so hard for this, but the addict also needs to want help. And that is also the other side of that coin. So some insurances are also getting pretty fed up because here they are and they may have a frequent flyer. And you're like, well, what's going to be different this time? So, there's
We're in a bad period
it's a
right
battle
now. No
going back
question.
and
You
forth.
guys, before we take another question, any comments? You guys are more professionals. I don't know if you want to comment on that situation because it is broken.
It's incredibly frustrating. So as a parent in the field, I've encountered many of the same problems that you have with my daughter. So I think part of what we have to look at is really working at not just navigating the system, but in the process fixing the system. Now, I do know one big change that I heard for the first time just a week and a half ago was that a parent actually called the state attorney general's office because their insurance company, United Healthcare, declined treatment. They were immediately given a case number, and the state attorney general's office was going to launch an investigation. So that's one thing that's changed, that if you call the number, and it's on, I think, Governor Cuomo's website, if you call that number, you will immediately get a live person on the phone, you will be assigned a case number, and they will immediately investigate to look at why it's being denied and getting justification from the insurance company for that denial. And the most important thing is that it's on record now. And God forbid if something happens or something goes wrong or there's a problem, there's a record of the complaint being filed. So that's something that's beginning to happen, but it doesn't help us right now today.
It's a slow process, actually. I mean, look, the governor is aware of it. We have spoken to Eric Schneiderman, the Attorney General. It's not going to happen right away, but these people are aware that this is really broken. And so you got to keep pushing and don't take no for an answer. I know that simplifies it, but I think we're going to make the change happen. It's not going to happen fast, but it's going to happen if we keep pushing. It's starting to happen. It is. We have questions. I have two. I'll get both of you, okay?
I just get kind of discouraged, well, not kind of, a lot discouraged. I'm a single parent, and I had my son one other time getting turned down because he couldn't die from opiates. I called the next day, and I said, why is he back home? Because now he's arrested because he needed to use. And he took my brother's car without a license, and my brother happened to want his car. And I was like, get back home, and then he almost overdosed. And so, I mean, that happened within like one day of him being out of detox, and that he didn't even be in detox. That was my nicest time with my son, driving with my son. He was like the old man that I remembered, like the organized guy that I knew. And we had the nicest ride going there. And then he got arrested. And my son always wanted to be that good kid that didn't have a record. And, and now he's got a record. And now the other time that he tried to get into, he almost was ready to get in to treatment, and he wanted to use the day of. It doesn't make sense, no, but I mean, would you say it's a brain disease? Would you say somebody had cancer? How dare you have cancer? And he got arrested. And so now he's in Rensselaer County, and the courts don't want to pay, the county doesn't want to pay for him getting help. And I said, but he was almost there. He was almost there. He was packed. And but they'll take him back from overcrowdedness to Rensselaer County to here. And I said, did you talk to anybody? Because I don't even know whether he has a mental health problem also. I mean, I don't know. But I mean, this is what the county's willing to do, bring him back and forth and have a postponement. That's what they're willing to do. So something's wrong here. And I want to flip out in courtroom. I want to really, almost, I'll get arrested.
Some of your son has control over that, though. So, like, once he's in the jail, he can try to seek what type of alternatives he can do. Like, if he's in there for drugs, he can see about seeking alternative to going into a program. And there's multiple different programs, so I think that's kind of what you're kind of hitting on. Like, there's multiple different avenues that don't involve insurance companies, that don't involve those barriers, if those are the barriers that you're having. You don't need them to pay for treatment. If someone's invited into a program, like for us, if we were to invite a lady in a program that's from jail, we would be getting in contact with the public defender asking for a release to our program as an alternative to the jail sentence. But he has to be part of that. Does that make sense? Like, he has to be like, what are my other options, or can I call different places?
Why don't you tell her about TLC?
Yeah, I have a program that I can offer you that might be able to help you, that can work with where you're at, that you can offer to your son as an alternative to what...
Am I making sense? I had a Xerox copy. I gave it to the public defender, and that still wasn't...
I think what she's saying is, she left this part out, is her son was ready to go into Graymore. They had a bed for him. He wanted to use that day like one last time, and he was demanding money, and they refused to give it to him, and the police got involved, and he ended up in jail. She got a letter from Graymore. Graymore was kind enough to write a letter saying, we have a bed for this young man.
Okay.
Please let him come here. And the public defender said something like, well, what did he say? I don't want to annoy the judge.
Has trained the court system.
To be honest with you, if you just give me the public defender's information, and if Graymore's still willing to do that, or if we can get you into another program, that's kind of my specialty, is advocacy, and then I can actually push my way. If the public defender won't do that, you can go to the judge himself. He's the one who makes decisions, not the public defender. So you actually have to go in different avenues when the public defender won't work with you. I've done that.
The other thing is that if he's over 21, the public defender's not going to listen to you. All right, so what you have to do is make sure your son is the one that's telling the public defender what to do.
I sent a letter that my son wrote.
He's just not working with you. I understand that. I can see if I can help you at a different level.
After the meeting, when you hook up.
Yeah.
Okay, you have a question?
I just really had a statement. If there's so much problem with all of the facilities that do take insurance, and there was that one case where they called the Attorney General, why isn't it a way of a standard that whenever people do have those problems, it's suggested by the facilities to do that? Here's the number for the Attorney General. Because the more people that scream out, the squeaky wheel, Right. I just think it should be something that everyone that does take insurance incorporates in their standards.
One of the things that we do at Phoenix House is that we actively advocate for the insurance companies, part of what happens is everything is evidence-based now. So you need to kind of jump through hoops and show the acuity level still requires that level of care. And which, a lot of times takes a lot of work to work with. But normally, we've had times where insurance companies have given 90 days of treatment. As long as the information is there and it's presented, so there are some cases where they will. It also depends upon the insurance companies. A lot of the smaller companies or smaller managed care companies, they're profit-based, so they're not going to give somebody, 60 days of treatment at $300 a day because that knocks off the capitation, the capitation for them. So part of what they have to look at is each case is individualized, and we always say to parents, here's the person that denied our appeal. Here's their phone number. Please call. Because a lot of times hearing that family history, hearing a parent say, I have been dealing with this for 8 years. I've been dealing with this for 3 years. And this is finally the first time that my child has been in treatment for a period of time and is still there. And they need a longer period of time. And so you need to work with us. And once again, if that doesn't work, contacting that appeal person, then filing a claim with the State Attorney General's office. The other thing is that programs can do step down. So a lot of times what happens is that as long as there's a direct transfer, a lot of times that helps too. But what happens often is that a detox unit, they only have 3 days or 5 days. It's a Friday afternoon. They got to get that person out. So where do you send somebody at 4 o'clock on a Friday afternoon? You set yourself up to fail. So part of what needs to happen from the day somebody goes into detox as a family member, you have to say, what is going to be the plan? Where can we refer my child to? From the day they walk in the door, as soon as you get out of the ER onto the unit, that's the first thing that has to start happening right then and there, because oftentimes it happens on the last day. The insurance company says, okay, that's fine. As Dr. Eva could probably attest to, a lot of hospitals now don't do opiate detoxes. You have to be benzos or alcohol in your system for an acute care hospital to do an opiate detox. Otherwise, they want ambulatory or outpatient, which doesn't work for many heroin addicts, straight heroin addicts.
St. Christopher's now does have a detox for all of you that may not know. They have a 10-bed detox. It's private pay, correct? I'm pretty sure, I'm almost positive it's private pay.
I know we have a flyer for it.
Okay. All right.
I don't have too much the
they
details
just
because it
opened.
just started.
Just opened.
But after the guys do come in, we also encourage them to stay for
of course.
treatment. So sometimes that's a way of getting somebody at least into the doors.
Right.
Because they get a little bit more used to the environment. They kind of buy into it a little bit more. And so far we've had, I want to say the majority, again, I don't have the numbers, but from what I'm seeing, the majority of people who have come in for the ambulatory detox has stayed for treatment and are still in treatment now if that's the case because, again, this just started a couple months ago, 2 months ago maybe.
I don't even think it was that long ago.
So, yeah,
I
something
think it was
like that.
like a month ago.
Probably.
You guys have a good program. What's your rate? What's your success rate? Do you know? I know David has mentioned it's pretty high.
65, 70%.
Yeah, I think
We
so.
have, I was just going to say, I have the numbers in our folders if anybody is interested. But I think it's above 50%, which is a good program. And our specific program, I believe, is about 70%. 72% then.
Do you know what your program?
I'll take your word.
What about you guys? You know?
You don't track?
Well, I can tell you this, evidence-based treatment, I think the average is 38%.
Wow.
Make it for 1 year.
The issue also is that you can't look at success rates because it varies as to whether it's 30 days after, 60 days after, 6 months after, a year after. So part of what happens a lot of times is if you get focused on the numbers, you can kind of get lost in translation because it depends. Different programs use different statistics or time frames to determine success as well.
To clarify, I believe our outcome studies, which we do in increments of 3 months, for over a year, it is about 50% still, which is still over the state's success rate. And then completion of our program is 70%.
And what about you? Have a high rate?
Yeah, after completion of our program and 6 months out, we have a 90% success rate. but we do 6 months out, so.
And part of it ties in with the longer period of time in treatment, the higher rate of being able to remain sober long-term, and that's an important thing to look at. So part of what families struggle with is that you go through this constant of, short-term detox, outpatient, short-term program, outpatient. So part of what we found is longer-term programs like Phoenix House, St. Christopher's, Walter Hoving, tend to have higher success rates because we're able to treat individuals for an extended period of time, or offer step-down programs where they can go from intensive rehab right into, community residence, or, not sober homes, because sober homes aren't as structured, but community residences where they are very structured, and there's programming at the residence during the day as well as in the evenings.
Which we don't have enough of those either.
Correct.
Dutchess County has Bulger House.
Yes, you're right.
What else do we have?
Right.
Dowling, Bulger, Dowling. The Dowling's a three-quarter house, right? They can still go to
My strongest recommendation for you would be for your son not to come back in the area. I am born and raised in Orlando. I went through Orlando for a couple hours, but I didn't go directly there when I was in Florida. I still don't actually go back there. My addictions aren't necessarily the addictions to drugs, it's to the people. So I'm like, oh, I need to go see blah, blah, blah. Well, blah, blah, blah is telling me they're okay, and then I get there and they're not okay. Where does that bring me back to, So it's like just staying away from those people, but I have to be very aware, and it's just because of what I made the area, not because it's a bad area. It's what did I develop that into? That's where I was born and raised, so I stay away from there. The best thing your son can do is develop a life somewhere else. I developed a life in New York, so...
Unfortunately, because of our insurance issues here in New York State, when you go into Mark, they are now marketing Florida rehabs and Florida House. So as unfortunate as this is, he was down at a program in Florida when came 2 kids from Dutchess County that were on his soccer team.
Is he in?
They're residents in Florida.
Is he in Delray?
That area.
Yeah.
Deerfield Beach, he was in incentives, and that's where the 2 others came because they went through Florida House. But I had a question for St. Christopher's. Your detox now, if you have a wait of 100 people on your wait list, what happens when they finish detox? Where do they go?
We have a shelter program.
Oh, so
We
they're
can't
living in the
necessarily
shelter
get
now.
into treatment making right away unless there's a spot, but, that is part of it.
Why don't you explain that your model is a little different? Could you explain it real quick?
I'm still getting used to the ambulatory detox. I don't want to give out too much misinformation, but we do have...
You have a different model. You're not an inpatient.
No, technically we are an intensive outpatient program, and the clients reside within the shelter part of our program. So if they're done with detox and they're awaiting their wait to get into treatment, we're not going to kick them out until their treatment bed is open. They do, I believe, stay with that incentive of going into treatment. So we do have a shelter program where they work for the shelter and things like that.
I thought that's where the beds are.
That's what the beds are considered.
The shelter and the treatment are separate.
My son went there. I'm well aware of St. Christopher's. Been there for 3 months too. But I was at when they were waiting, the waiting period. Because last time we were waiting for St. Joseph's, he was at Mark. It was a 2.5-month wait for St. Joseph's. You can't sit at Mark for 2.5 months waiting for your bed at St. Joseph's. We're jam-packed here in this area. We don't have enough places.
Well, the problem is that this is an epidemic. They can't respond fast enough to the epidemic. That's the problem. Like there aren't enough places for them to go. It is a big problem.
Other comments? Going to wrap up soon. Sure.
She doesn't have to.
Oh, thank you. This is a question a little off topic. My son is a heroin addict, but in very, very early recovery. And he's starting his 3rd week on the Suboxone. And as a parent, my husband and I, of course, have concerns about him being on the Suboxone. So I would appreciate maybe comments from the panel regarding
what are your
Suboxone.
concerns?
Well, he will have to withdraw from that at some point, or the doctor will have to wean him off that drug at some point, the Suboxone. And I'm just wondering, how long should someone be on Suboxone?
Okay, but if it's working, why worry about that at this point? In other words, I think sometimes what happens, as parents, we kind of jump ahead to, look at, well, what about this? But what I would say is that if he's following the Suboxone protocol and it's helping reduce cravings and, sustain sobriety, and he's, either in some type of treatment, because anybody on Suboxone should be going to meetings or going to A or NA and going to some kind of outpatient treatment to support that. But what I have found is that it varies. Some young people need to be on it for an extended period of time. Some don't. It's really up to the individual and whether or not the Suboxone is working effectively and they're using it effectively. And I don't know, Dr. Reber.
I'm not yet very familiar with it, but I compare it a little bit to the nicotine patches and so forth. I mean, they are also addictive, and if you're trying to stop smoking, you have a regimen and you have to go off it. And as long as you're not back on the cigarettes, it doesn't really matter how long it takes. Every individual will be different.
And you don't need to be detoxed off Suboxone. It's just, gradually reduced over a period of time based on whether or not the individual is sustaining sobriety.
I would just like to answer from an addict's point of view, because I was on the Suboxone program. I just have one question. Is he being distributed from a doctor and he gets a month's worth at a time?
No, he's on weekly visits.
So every weekly they give him however many?
7 days.
Okay. What I did with Suboxone, I'll tell you my own personal experience with Suboxone. If I couldn't get that high that day, I took Suboxone. So what I did with Suboxone is I filled in the gaps of where it is that I couldn't get high. That's what I did. I'm not saying other people don't use it for that, but you're putting a Band-Aid over a severe problem. Exactly. I would worry about it. I know he's telling you not to. I would personally worry about it. One of the worst things I did for myself was going to the methadone program. That took me 30 days to not feel it anymore, the physical withdrawal. I'd much rather go through the other withdrawal. I never personally went to a detox for any of my addictions. I just didn't do that. But I would be concerned, and those would be conversations that you can even openly have with them. Is he using it the right way? If somebody could distribute it to him on a daily basis, I don't know, it could be managed differently, but you're giving a drug addict a Band-Aid and you're telling him to do it in a healthy manner, and that just sounds a little, it sounds a little off,
Well, my son was on Suboxone also, and we did administer it to him. So we had to give it to him every morning.
Which is why it's important that he's in some kind of treatment or counseling and going to meetings as well. Suboxone in and of itself is not necessarily going to be the end-all to end-all. Right. It's important that most doctors who prescribe Suboxone require those individuals to be in some type of treatment or therapy in addition to Suboxone, and strongly encourage a 12-step meeting attendance.
Yeah. Meeting attendance that can be manipulated. You're talking to a master manipulators. Right. That it just becomes this really funky zone. Where is he at? Is he trying to do that to get better? Because he can use it in the right method, but where is he at?
Yeah, well, those are our concerns, and he did intake for his outpatient. Hopefully, it'll start next week at Turning Point. But as we all know, there's a lot of ifs with that. If he stays in outpatient, he's not going to meetings regularly, we know as a family that this is not enough for him being on the Suboxone, and as parents we have concerns about it because, like you said, we look at it as a Band-Aid, but he's not shooting up, so you have to take comfort in that.
That was my family's.
I'd like to say something. We have a support group for the parents on Tuesday night, every other Tuesday night. We, for myself, I went to Al-Anon, which was, we really need to focus on ourselves too, because we are addicted to our children's disease. and it takes over our life, and we really use all our energy in trying to fight their disease, when in reality they're adults, and they need to take responsibility for their lives. They have to take responsibility for their own living. And so I think it's important that the parents in here that are struggling get into a support group of some kind. Naranon, Al-Anon, as I said, we have our support group on Tuesday nights at the Mayapack Library every other Tuesday night, and you're more than welcome to come. Debbie comes, and Sue came, and it's a good support group, and we won't tell you not to think about your kid there like Naranon does, and that sometimes is off-putting, but there is some truth in that. You need to take care of yourself, because if you don't put the oxygen on you first, you can't put it on your kid anyway. So you need to let go and live in your own life in the present moment.
Yes.
Don't be afraid as a parent to set boundaries. You shouldn't have to live in your own house. You're going to worry, be upset, and stressed anyway. Don't be passive. You and your husband, take him to family counseling. Sit down and talk with the therapist or the counselor and set boundaries there. We want to administer the Suboxone to you. We're going to give you the pill. You're going to take it. That's how it's going to go. Or these are the boundaries we have. If you're going to live with us and we're going to support you, or you're going to be on our insurance, you need to go to AA every day. I mean, you need to talk with your husband and set something up, set boundaries, what's comfortable for you, so that he has to follow them. If you don't, it could get out of control again. You could be worrying every night. You could do that anyway. But I just have found you have to set boundaries in order to, take care of yourself. And you have that right. What about a family sit down with them? I mean, that might seem, I understand, I've been in that situation, but there's a time where you have to actually include other people in the family to get them, to get established. Yeah, it's complicated. I understand.
That's why she comes to this.
Yeah.
Anybody else? We're going to wrap up. I think. We had some providers here tonight. So if I don't know, make sure you know how to get a hold of these people if you'd like to get some more information about what they offer or their suggestions, because they're good resources here. I think, is that it? Good? Any other comments from the panel? Thanks a lot for coming.
Thank you for coming.
Don't forget that you are farmers with pickaxes and shovels, and you should go to war, okay?